If you lose all your hair before you're 24.
Hello, welcome to our Q&A session. Today we'll be addressing the question of how long does it take for me to see my results after a transplant. So you've had a transplant and you're wondering when will your result be ready for prime time. The best thing to do is to tell you the processes or the different timelines for a typical transplant. So following a transplant, the first thing that will happen is you will have, the scabs and the grafts will be in place. You will see this little tiny hair sticking out with a little bit of blood, a clot around them in the transplanted area. That looks obviously transplanted at the time. Now, in a period of usually about 2 weeks, the scabs will come off. And when they do, in most patients, there will still be this hair sticking out. This is all temporary. That hair is going to fall off. It's expected most of the hair will fall off. Only on very rare instances will most of the hair remain. So for up to a period of about 2 months after the transplant, everything that you see there by way of hair, new hair planted, is likely to fall off. And that is just the way things happen. It's called telogen effluvium, and it's an expected course of events. Once that happens, you'll be left with an area of redness. Your hair loss state will be similar to what it was before the transplant. And then until about the 3.5 to 4th month, that is when you should start expecting to see some activity. At that point, you start seeing some hair sticking out. But at that point, it's not going to be uniform. It's going to be just patchy, because every individual hair is going to do its own thing at its own time, at its own pace. Also, this is about the time that you may start noticing some pimples in the area, and that's usually ingrown hair or hair that's trying to poke through the skin. And sometimes there's some irritation and there's some inflammation and you have these pimples. So in a way, in a manner of speaking, that in itself is good news. It shows that your hair is beginning to grow. Obviously, you don't like the pimples, and if they get out of hand, then you should contact your hair transplant doctor to treat that separately. We now have a timeline of about 4 months when you start expecting some growth to start happening. So at that point, cosmetically speaking, it's not remarkable. It's very patchy. It's really not that aesthetically pleasing. But as time goes on, as the weeks build on, more hairs start to poke out, so the area starts looking a little bit more uniform. And typically at about the 6 to 7 month, you will start seeing a more uniform spread of new hair, albeit shorter hair. So it's still not ready for prime time. I usually advise my patients at that point to, just cut the hair and keep the overall hair or head, groom it short, so it kind of blends in better with the newly growing hair, which is still short at that time. It takes typically about 10 months for a majority of the growth to manifest. However, you could still experience some more growth happening, but at 10th month, a lot of the hair is quite long, and aesthetically, a lot of patients are really ready for prime time at that point. You can groom your hair, you can keep your hair longer, depending on the type of transplant you've had, or your preferences, usually at about that 10th month. Maximum growth or the complete growth potential could take up to 18 months. Usually we tell patients that by 1 year, you know whether your transplant is to your liking or not, by the 12th month mark. So far we focused on the growth. What about the quality of the hair? For up to 10 months, you're going to be having growth, the hair will be new, but the hair has not matured. And part of the maturity process of the hair includes changes in texture, changes in shine and sheen of the hair, the way the hair behaves. That takes time, and it may take up to 18 months for the hair, the new hair, to acquire all the characteristics that is required for it to really blend very well with the rest of the hair around it. So when is the best time to really call your results after a transplant? I would say 18 months if you take growth as well as maturity into account. But if you're just looking at growth, then by 1 year, you should be ready to make a decision as to your satisfaction level in terms of growth. I hope this addresses the question adequately. Thank you.
Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you. Pick up the phone, make an appointment for you.